we have seen the rise of turkey teeth. And I think it stems from Love Island and shows like this, where people essentially go to Turkey, they think they're getting veneers, but they're getting full coverage crowns, which is where you have to basically drill off about 60% of your tooth surface, which is crazy. But the problem with that is it doesn't last forever. They've gone abroad, they've had like 20 crowns placed, and within maybe a month or two, some of the crowns have come off. Oof. And we look underneath the crown and we take an x-ray, and guys, the destruction is unreal.
Welcome back to the 101 podcast with Serena Organics. You're here with myself, David, and my fellow co-founder, Joe.
Hello, and today we have the pleasure of welcoming an amazing guest, Dr. Simmi Daryani. Now, Dr. Simmi is known as the Invisalign Queen. She has done over 600 successful Invisalign cases. She works with Invisalign themselves on a consulting basis, advising people on best tips with Invisalign. And she's also received many awards from Invisalign themselves. Dr. Simmi, good afternoon. How are you?
Hello, I'm good, thank you. Thank you for having me today.
Thanks so much for joining us on this podcast to be able to discuss all things orthodontists, yourself, dentistry, and of course CBD as well. Yeah. Why don't we get stuck right?
Yeah, thank you for coming on to speak with us today, Simmi. Could you just tell us a little bit about your background and how you got into your work?
So I got into dentistry after doing work experience in several different kind of sciencey work environments. So I wasn't someone that knew from the age of like 10 that I wanted to be a dentist. It's definitely something that I've kind of explored, and then I kind of made my mind up when I was in my AS level year of school. I just basically, my mum and we just set up a bunch of work experience, and I wasn't quite sure what I wanted to do. I was always really academic and I was really strong in the sciences and maths. And then I set up a work experience at a dentist's practice, a doctor's practice, also like looking at optometry and pharmacy and all these other things in science. And I think what it was two things. One, it was the fact that by that age, I'd had life-changing orthodontic experience myself. So my teeth used to be really, really bad back in the day when I was like 11, 12 years old. I was always like very smiley, very bubbly, but I was really embarrassed of my teeth, which, you know, I mean, it didn't hold me back, luckily, but I mean, as you get older, I think you get more conscious of how you look and things. So by the time I was like 17, I'd had that life-changing orthodontic treatment. I had braces for 2 years, like the full-on train tracks. My canine used to be in my palate. Like it wasn't even like visible in the mouth. It was, yeah, honestly, guys, I was a really difficult case. And then once I'd done that, I obviously thought, you know, my orthodontist was a magician. Like he'd basically just given me the smile I always wanted. And then I did experience with an implantologist who was also a max fac surgeon. So I shadowed him. And then I realized, firstly, how vast dentistry is. There's so many different aspects of dentistry. And secondly, just his attention to detail. Like he's just so meticulous. That relationship that you build, like that rapport you build with your patients, if you're a people person, like I am, it's really lovely. It really makes the job feel so rewarding. So it was all of those things together. And then I decided to do dentistry. And yeah, I've been a dentist now for 10 years. Oh. But I really found like my passion when I started doing orthodontics, which was about 6 years ago.
Great. And I mean, it's amazing when we follow you on social media, see actually that passion translating whenever you're giving tips to your followers or talking about the clients or the cases that you've had and seeing the before and after. That's really, really good.
It's honestly, it's so rewarding, like truly, I really mean that. And I think it's because I had that treatment myself and it was just something so life-changing for me. And then the fact that I get to give that like gift to others is just amazing. So I feel like I've come full circle. And yeah, it just like, it just completely transforms someone's, it's just like the psychological impact that it has on other people, on patients once their teeth are straight. It's amazing.
Yeah, I was going to say, you must really be able to like empathize with their situation as well, having gone through it yourself.
100%.
So when they're coming to you and obviously they're like quite stressed or they're upset or they're in a predicament, you can obviously like reassure them and help take them on their journey.
Yeah.
And obviously afterwards seeing, like you say, the finished result must be amazing.
No, it's you know what, I get messages and inquiries on my website because I have a contact form on there, and people message me with their concerns. And every time I read one of them, like I'll read you guys one now. Like we're going off script, but like, but just so you can see, okay? This is just, obviously I won't say who this was, but it's when I get these messages and I read them, I get like excited to take on the case and like see the teeth in person and treat them. Like I just love it. It's challenging. It's like problem solving. Like psychologically, it has such an impact on people. It's just, honestly, I just love it. So, okay, this is an example of a guy. So this is what he messaged me on my consultation form. So he wrote, "My teeth are a mess, always have been. I've hidden them and put it off for years, but I want to get them sorted out and be able to smile proudly."
Oh, bless him.
Isn't that sweet? Yeah, so it's just, and it goes on, it's not much longer than that, but just so you get an idea. So it's just, yeah, it's very meaningful, it's very rewarding.
So you're almost like everything embodied into one: a therapist, a dentist, a cosmetic surgeon. You just say, we can get this done.
I'm an all-rounder, guys.
And I mean, you've been involved in over 600 cases alone just with Invisalign.
Yeah.
It'll be interesting to kind of understand some of the misconceptions that surround Invisalign and cosmetic dentistry, which I'm sure you've heard many through your contact form or some of the clients you've spoken to, or just you on a day-to-day basis.
Yeah.
So could you kind of take us through some of the most or massive misconceptions that people tend to think are hindrances to them getting involved in cosmetic dentistry?
So there's a few. So I'll say, okay, there's like two main ones I can think for Invisalign, and then there's one big one for cosmetic dentistry in general. So with Invisalign, some misconceptions are, one of them is I need to have teeth taken out to straighten my teeth, and that's not the case. There are a lot of children that do have teeth removed, and you know, when they have fixed braces on the NHS, like it is quite common. But a lot of the time with Invisalign and with adults, you know, adults don't want to have teeth taken out, which is totally fine. And pretty much all of the cases I've done have been non-extraction. And I'm quite minimal in my approach to orthodontics. So wherever I can, you know, avoid taking a tooth out. I always will. I think, you know, keep as much as you can. They're your teeth. And especially if they're healthy, and if you can keep them in, I always will. So yeah, one of the common misconceptions is that you have to have a tooth removed, and you don't. You can totally straighten your teeth without that. Another thing I'd say is some people think that Invisalign or fixed braces are going to take years and years and years, and it's going to be really painful. And to be honest, fixed braces, metal braces that I also provide, that is definitely, there is a lot more force on that. You definitely feel it more. But with Invisalign, I think it's really good for adults that are working and, you know, just have all this other stuff going on in life, because it is less painful than fixed braces. It is more gradual. Don't get me wrong. There is some kind of, it's almost like a teething pain. And, you know, they do feel a bit achy, the teeth, because they're on the move. So of course you're going to feel that. But certainly it's not super painful. And in terms of treatment time as well, most of the cases that I do usually take, I'd say on average between 6 and 12 months. So they're not going to take years on end. There are, of course, those really complex cases that I treat. And I love treating the complex ones as well, but because it's like a challenge. And those take like 1.5 to 2 years. I mean, they can take a lot longer. But I would say, honestly, the majority of adult cases that I treat, about 6 to 12 months. So it's not something that's going to take so long.
Sure.
Yeah.
I think that's one of the misconceptions that I had. Well, maybe not a misconception, because mine's actually taken 2 years, but I need to have an extraction as well.
Oh.
But we were saying that I should have come to you before
You should have come to me.
start my process.
Could you reduce this time?
I mean, I need to see his teeth from the start. I don't know what
I've
your
got the
case is
scan.
like. Let's look at photos after. I'm interested to see.
Well, when you talk about those misconceptions, I think those are some of the misconceptions that I had held, even as a kid as well, even with braces.
Yeah.
Because I was offered braces when I was younger, but I said no because we're in this face.
Yeah. And also kids care about looking cool and they don't want to be like brace face. But honestly, if there's any like parents watching this or like children, just get braces, guys. It is good to do it in your teenage years, because you can actually change things to do with you can modify some of the growth. So when you're a teenager and you're going through puberty and you've got braces, this is different for adults, you can actually, if someone's chin is too tipped forward, you can actually tip it back in.
Oh.
Yeah. Or if someone's upper jaw as well slightly set back, you can actually use growth modification to kind of bring it forward. So there's things you can do when you have braces in during puberty that is amazing. It's honestly amazing. So just guys, get braces.
Slightly more limited in adult life.
Sorry?
Slightly more limited in adult life.
So when you're after puberty, your like skeletal pattern is set. So like your jaw is the shape of your like jaw and the positioning is kind of set. So you can totally correct the alignment of the teeth, get everything looking beautiful, but your face shape is your face shape, and that can't change as an adult.
One of the things my dentist said actually was if I'd had it when I was young, because I've got a tooth, one of my canines are growing inwards.
Okay.
And he did say that there's a chance it may not come out anymore because it's already formed part of the bone. But he said if I was younger, it would have been super easy to kind of bring it out. So I think that's something you're talking about when it gets to like children and adults.
Yeah.
The longer you leave it, the more the tooth can get fused in with the bone or something.
Yeah, it is. I mean, having treatment in teenage years is like, honestly, it's the best. But I think orthodontics has really shifted. So like 20, 30 years ago, I feel like we just associated braces with like a little acne teenager. Like that was kind of the association. Adults didn't really have braces. They didn't really straighten their teeth. Like it's just not something that was that common. But now it's completely shifted. And I think the reason for this is because people have realized that our teeth are actually constantly moving through our life, which I know kind of sucks. But you might have completely straight teeth. And just with time and with age, our intercanine width or our intermolar width, so our arch width just narrows. So it's just part of the natural like aging process. You get a little bit of narrowing. And then because of that, a lot of people end up getting overlapping of their teeth on the front or crowding. And so things can shift. And that's why I think people are realizing this, and so many patients are coming in their 20s, 30s, 40s, 50s. Like the eldest patient I've treated so far was 72 with Invisalign, which I think is amazing.
That is amazing.
She was a retired doctor, and she was very like well groomed, like really put together. She's goals for me. But she said that her teeth randomly started overlapping in her 60s, and she didn't like it. And she's like, no, I've got to sort this out. So yeah, and it really is for any age now. And Invisalign, it makes it accessible to every age because, you may not want to have metal brackets on your teeth as an adult. And, like you're doing Invisalign right now and you can barely see it.
Can't tell.
Look, guys, can you see it?
I think that's what I like about it. But I think that's what I like. I think it's that, not invisibility, but it's less obvious than the braces in itself. Yeah. And even though sometimes I do find it quite painful, so I wonder what braces would have been like, but it's still something.
It's more hardcore.
That's good to know.
When I had braces as a teenager, and you go to your orthodontist every like 4 to 6 weeks, and they change your wire over, and literally for a day or two, I think I just didn't eat. Like it was just so achy. But it's just the way it is. But I don't regret that. I would do that 100 times over. It was amazing. Changed my teeth.
And Dr. Simmi, it will be great to get into, as one of our ambassadors, you obviously use our products, and it'll be great to get into what our products help for you. I think before we go there, it'll be good to kind of understand what a typical day kind of looks like for you. What kind of some of the stresses and triggers that come along with the world of dentistry. Can imagine there's a lot of offloading of people with their issues, but it'll just be good to kind of understand it. And how our products or CBD helps you in general. So
I've been using 2 of the products that are just like, they're like my ride or die now. I use them every day and I'm obsessed. But yeah, if we back up, basically with dentistry, and I think any dentist, if they're listening to this, will completely agree, it is very straining on your back. So like physically, it's quite demanding because you're like looking into people's mouths, and you're just kind of, there's a lot of strain on like the wrist, the neck, the back. And then of course, like psychologically, like you were saying, it's kind of like being a therapist and everything in one. It really is like that. You take home people's, worries, and you kind of absorb them. I think it's something over time, if you're a doctor or a dentist, you try to minimize and you kind of get used to it, and you just like kind of condition yourself to not absorbing everybody's energy and emotions all the time. But you can't help it. You just kind of take the stress home with you a little bit. That's the thing. So with Serena Organics and the CBD products, the 2 that I need to use every night, and now it's part of my nighttime routine, especially like after like a long like clinical day, is I'll come home and just before bed, I will take the CBD drops under the tongue. And I just find with that, usually it takes me a while to fall asleep, and I am someone that like I'm problem solving my cases in my head, even when I'm at home and I'm like thinking about things. I really try not to. Like my partner is always like, Simmi, you need to like draw some boundaries, in life. But it's hard, okay? Because I care about the work I'm doing, and it's just naturally like you're thinking about it all the time. So sometimes it takes me a while to switch off. But with the CBD drops, I find that I take those and then I go to bed half an hour later and I fall asleep so quickly, which usually is not the case for me. And also my sleep is quite deep, which I didn't expect to kind of see that, or I didn't realize I would, but it's like very deep, like good quality sleep. So I'm sure you can tell me like there's probably a scientific reason for why that is, but yeah, I think that's one thing. And then the second thing that I'm doing every single night is applying the CBD cooling gel. So I've been applying it basically like everywhere where I feel like a bit of strain during the day, because I always get a little bit achy towards the end of the day after clinic. So I apply it kind of like on my neck, like my back, like the shoulders a little bit, and then also the wrists as well, because we're constantly working with our hands. So I do that every night. And then in the morning, everything just feels eased. It just feels a lot better, and it doesn't feel like a stiff or like tight anymore. Like it feels soothed. So yeah, those two are big ones for me.
I'm glad you had such positive experience with them. You touching on how it helps with your sleep. I mean, CBD interacts via what's known as our endocannabinoid system, and that essentially dampens down our nervous system, so our parasympathetic nervous system.
Oh, okay.
So that's why it has really amazing effects on like helping people basically calm down if they're feeling stressed, shut their mind down and body down when they're going to sleep. Also reducing the pain signals that can also be firing from long days of working, removing teeth, all that sort of thing, where you do get that strain. I have a friend who's also a dentist, and she says also how it can be very tiring, especially on your arms,
For sure.
like forearms, if you're constantly in people's mouths, and especially on your back, of course, if you're always leaning forward. Then obviously the taking stress home side of things, I mean, that comes with the compassionate aspect of your role, I guess. So
yeah.
It's not always easy to be able to just turn off from work. So having some more drops in the evening to just help your mind on that side of things is definitely helpful. So yeah, obviously pleased that's been going for.
No, I love them. I'm obsessed. If any dentist is listening to this, you need to try this. Honestly, it's very helpful. Or actually, anyone that has like a physical job, I think, like a dentist, and then the CBD oil for the anxiety part or like the switching off. I think, to be honest, I think everyone could do with that.
Yeah, I think where the world is so busy anyway, and a lot of people like yourselves take a lot of work from the office home, and they find it difficult, like when it's time for bed, switching off and just being able to stop thinking about what's going to be happening tomorrow, what I need to do, or the problem solving I need to talk about. And that's kind of where CBD is quite helpful for me personally as well. It's something that I enjoy just for that.
Yeah.
Yeah, I take the 40% every morning.
Oh. I haven't done the morning before.
Just keeps you calm and composed.
Oh my God, maybe I should do both times.
Yeah, you can definitely try it in the morning. We normally say to most people three times a day, or as and when you kind of feel that you require it. So, you've got a lot of inquiries in your inbox. It's not
That's why you guys are always just like so composed and chill and put together. Every time I see you.
You haven't seen us outside the podcast.
But it's really, really impressive as well to kind of hear about the work that you do. And I think for those who are listening, there are a lot of people who are very conscious about the way they look, about the way they're presented to other people. And they might even just be considering Invisalign now or braces. What would be some of the key tips or key important messages that you'd give to people that are considering braces or Invisalign? What should they look out for? What should they be conscious of? How do they spot a good dentist?
So there's a few things. So firstly, I'd say don't choose a dentist based on the price or the fees. Choose a dentist based on their experience, okay? Because not everyone's experience level is the same, and that's in any field. So have a look at how many cases they've done, have a look at their before and after photos, and then have a look at if there are any cases like yours. So for example, if your case is an overlapping case, your teeth are crowded, have a look at their photos on that, or have they done any spacing cases if you started with spacing between your teeth, or if you have an anterior open bite and your teeth don't close together properly, have they done cases like that? So look for cases that are similar to yours and see how long it took the clinician to do them and what their experience level is. So that's, I'd say, the most important thing. Secondly, I'd say always book in for a consultation with the dentist that you're looking to do treatment with, and just see how you find them. Ask them all the questions you have. I think, I don't know, the relationship that you have with your dentist is almost, you need to feel like you really trust them. And it is, it feels invasive, and a lot of patients are quite nervous to do things with their teeth. So you've got to feel comfortable. Choose a dentist that you like, because with Invisalign or with fixed braces, you're seeing that dentist regularly for 6 months to 2 years, right? So it's got to be someone that you actually like as a person, and you like their personality and you trust them. Because if you don't, it will seem like a very long process. And other than that, things to bear in mind clinically, I would say with Invisalign, you're wearing your aligners. You'll already know this, but you're wearing them 20 to 22 hours a day. So literally all day, every day. So you've got to be in a place where you're motivated to do it, and you are wearing them, because at the end of the day, it's an investment and you want to get the most out of it, So you don't want to slow your own progress down. So just make sure that you're in a place in your life, you're ready to, be committed, and make sure you're wearing them the required time. Other than that, something to know is that, and you'll know this already, is that you need to have a retainer that you're wearing at nighttime once you're finished with straightening your teeth. And that applies whether you're doing Invisalign or you're doing like fixed metal braces, because our teeth always want to move back to where they were. It's just a sad fact of life, guys. So you need to have a retainer. And I would honestly, out of the 600 cases of Invisalign I've done, I would say maybe about 520 of those patients had braces before as teenagers. NHS. Teeth were perfect.
Oh.
They didn't wear their retainer, or they lost their retainer, or they broke it, whatever it was, and then their teeth moved back. And then they end up doing Invisalign with me in their 20s, 30s, 40s, 50s, okay? So just learn from their mistakes on that one. If you're going to do it, be committed, and just be prepared to wear a retainer at night. It's not every single night forever. It starts to go down in the number of nights per week over time. But it's just something that I think people should know before they get into starting Invisalign.
Awesome. Yeah. And I guess that there are those people or some people who they want to fix their teeth so quickly. They sometimes aren't prepared for the journey, and they decide to get another form of cosmetic dentistry, like crowns or veneers.
Yeah.
For some people, I guess those who are listening now, and maybe they were considering that, and they've heard the misconceptions, they've heard the tips and tricks and things to look out for. What would you say is a difference between Invisalign braces, cosmetic dentistry, with things like veneers and crowns and stuff like that?
Okay, so this is a big bugbear for me. I'm really pro orthodontics and passionate about it because it's so minimally invasive. You are just using your own natural teeth and putting them in a better functional and aesthetic position to get that, dream smile that you've always wanted. I mean, what is better than just having your own teeth? Nothing, okay? And we have seen the rise of turkey teeth, if you've seen that in the media. And I think it stems from Love Island and shows like this, where people essentially go to Turkey, they think they're getting veneers, but they're getting full coverage crowns, which is where you have to basically drill off about 60% of your tooth surface, which is crazy invasive. And they have like 20 crowns, and they come back and their teeth are very... you can tell that they're fake. Let's just put it that way. They're too white. They're too blocky. They don't look natural at all. And the problem with that is, if that was it and then that lasted forever, then fine. Maybe some people would prefer to do that because they just want to just go quick and not take time to straighten their teeth naturally. But the problem with that is it doesn't last forever. I have had several patients come into me in the clinic as emergency appointments where they've gone abroad, they've had like 20 crowns placed, and within maybe a month or two, some of the crowns have come off. Oof. And they've come in to glue the crown back on. And we look underneath the crown and we take an x-ray, and guys, the destruction is unreal. Like, most of the tooth is missing, the gum is really inflamed, they've developed gum disease, they're having pain from the tooth now, then they need root canal treatment because they're getting nerve pain. Eventually that will fail, and then they'll need an implant, and that's going to be so much more costly than what they did originally. It's just, it's a bit of a disaster, and I think there are some amazing dentists that have raised awareness for this issue. But I kind of want to add to that as well, because if anyone's considering kind of just going abroad, getting 20 crowns and then going down that route, please don't. please just straighten your teeth, because just by straightening them and doing a little bit of whitening, or maybe adding a little bit of composite bonding, which is very popular, which requires no drilling to the teeth, but just adding a little bit of filling material to the edges of your teeth to kind of change the shape, to make them more aesthetic, just little things like that can just make your smile just perfect and beautiful and long lasting, and just, again, minimally invasive. That's the main thing.
That's good to know, because the amount of Love Island teeth I see going around, it worries me.
Yeah, it's really bad.
Okay, perfect. Well, thank you for sharing that, Simmi. Is there anything you wanted to ask us?
So the question I have for you guys, we're going to flip the script now. You guys are in the hot seat.
I'm worried.
What's your oral hygiene routine? We're going to talk about the perfect oral hygiene routine, but before I tell you what it's meant to be, I want to hear from you guys.
Oh, I'll go first, because I don't think mine's great. For my sins, I don't floss as much as I should. So I do. Okay. I brush every morning. I brush every evening. I don't brush in between meals. I'm not sure if that's good or bad, but I do try and floss every morning, every evening, but sometimes
Okay, I appreciate the honesty, so that's good. Step one.
I take too much CBD beforehand. I just want to go to bed.
What do you use to brush your teeth? A manual toothbrush or an electric?
Electric.
Okay, brownie points for you then for that.
Perfect. Oh, wait, I'll take some brownies.
I think mine's quite similar, apart from the fact that I floss.
Okay.
As much as possible, even when I haven't eaten. Sometimes I actually like the feeling there.
Amazing.
I also got a water pick out of my mobile. Thanks, Mum.
That's literally what I was going to say.
I kind of use once I finish eating. So in the morning when I wake up, I'll brush, I'll floss, I use the water pick. When I finish eating, if I'm at home, I try my hardest to brush my teeth. From a restaurant, I'll just with a little water and try and get as much out as possible.
Oh my God. He's killing it.
He's like the perfect case study. Joe should be telling us how to do it.
I
know. Oh my God.
Do you know what it was? I went to my hygienist, and then when she cleaned my teeth, she was like, you need to look after your teeth now. Blah, blah, blah. So I just felt all new and clean. You just feel like you got clean teeth. I just want to keep it.
Yeah.
So I think I'm due in 2 months, so we'll know if I've done that. Okay. But I try and brush as much as I can before bed, but sometimes I'm way too tired.
No, don't even say it. I hate when people come in, they're like, oh, I just kind of missed the one before bed. I'm so tired, I can't be bothered.
That's the one I need help with.
That's the most important one. I mean, the morning and the evening, they're both important, but literally everything you've been eating the entire day is just there, sitting in your mouth. You can't go to bed,
stewing overnight.
guys. You don't
That's
miss,
the one
don't
I need
miss
to
that.
change for them.
Okay, let me tell you what the official kind of guidance is of the best oral hygiene routine you could possibly have from home.
Please.
So, of course, brushing twice a day with an electric toothbrush over a manual. Electric toothbrush is a lot more efficient at removing plaque and works a lot better. So a good one would be something like an Oral-B.
I've got that one.
Look at you, teacher's pet right now. He's like, yeah, I'm doing that. So an Oral-B. I have the IO9, but really any of the IO, they have the IO8, IO7, IO6, kind of like iPhones. They come out with a new one every year, okay, and the number goes up. So same thing. So whatever one of that you have is amazing. Secondly, you're meant to floss once or twice in the day, okay? But if you could do once, at night, it would be better than even the morning. The more modern version of string floss that's come out now is what you mentioned earlier, which is the water pick, water flosser. And I'm using that now. I bought my parents one for Christmas. I've made everyone in my family just switch to that. And it's just, you know what, you should try this. You might like it.
Do you know, I have tried it, and it blasts your teeth. It really cleans
it's just quicker and it's more efficient, and it is meant to be a lot more effective than string floss at removing plaque between the teeth. Because the thing is, even if you do an amazing 2 minutes of toothbrushing morning and night with your electric toothbrush, it doesn't get in between the teeth. And so to clean in between the teeth, you either use floss or you use the water flosser. And the water floss is great. It will you'll do the entire mouth in a minute. You just fill it with warm water and kind of just go across your teeth, upper and lower, and it will just, jet wash out anything in between. So that's amazing. And third thing that neither of you mentioned is a tongue cleaner.
Oh God, I use the tongue cleaner. I do use the tongue cleaner. I actually use that.
Do you actually? I can't believe you left that out.
Every morning as well. I actually use it Okay,
you would have got full marks if you mentioned that. So you
I
missed
do
out
use that as well. Oh gosh, well, I use it.
A tongue cleaner. I feel like with patients, I always ask them when they come in for a checkup, so what are you using? And I feel like in this country, not that many people use a tongue cleaner, I've been using one since I was a kid, and I think maybe that's because even though I was born and bred here, like I'm of Indian descent, and it's kind of a thing, like it stems from Ayurveda and Ayurvedic medicine. Like the tongue cleaner is very important for oral hygiene and health. So I've been using it, but in this country, not many people use it and they're not so aware. But honestly, the bacteria and the debris and everything that collects on the tongue is a major source of bad breath and bacteria in the mouth. Like we need to be doing that twice a day, people. So just want to throw that out there.
I do have a tongue cleaner. It might be gathering a bit of dust though on the side.
No.
I'll get back to it. You've inspired me.
Morning and night. Okay, and then the last thing I'd say is with mouthwash, a lot of people think that you use this straight after brushing, but actually the time that you're meant to use it is between brushing. So like during the day or after a meal or like whenever you want to refresh, not with brushing, because the reason for that is because your toothpaste already has fluoride in it, which is what remineralizes the enamel and can stop early lesions of decay, okay? So, which is amazing. And then mouthwash contains the same thing, fluoride. So essentially, you've already put fluoride on your teeth, and then if you mouthwash, you're just putting the same thing again, but you've already done it. So it doesn't have much benefit. Whereas if you do it, between meals during the day, then you're actually, it's another time in the day you're getting fluoride onto your teeth. So that's why you're meant to use it in between.
So it's better to take one around with you throughout the day.
Just take one around.
Just carry one around.
Yeah, I know from your tone of voice you're not going to do that. But
do they do any like pocket-sized ones?
You know what? I'm using a really good one, and it's like a foam. So it's not like actually liquid. It's like a small bottle of foam. I think it's by Regenerate. And yeah, it's like travel sized, and that foam then when you like swish it around in your mouth, like turns into like liquid.
Oh, nice.
So there's some really good ones that are like more compact, so it's like less awkward.
Well, Simmi, thank you. I think you've given me a lot to take away, changing my daily routine. But yeah, thank you for coming on and sharing so much wisdom with our community.
Yeah, it's been great. Thank you so much.
No problem.
And I guess for those who are considering getting aligners or maybe not veneers or crowns,
Veneers and crowns,
where can they find you?
So I am on Instagram at Dr.Simmi London, Simmi London. And I've got loads of cases on there and things, so you can have a look at my work and feel free to message me on there. And then also my website, drsimmidaryani.com. Maybe you guys can write it in the description of this video.
It will be there.
Spelling. And yeah, you can contact me on there if you would like to straighten your teeth.
Amazing. Thank you so much.
Well, it's been great, Dr. Simmi. Thank you so much.
Thank you guys for having me.
Take care, guys.
Take care.
Bye.